Hi Jollibees! Good morning! So, I'm so early for my morning shift. So, our shift starts at 7. So, it's 6:30 right now. So, I am on a long day. So, long day shifts are usually the busiest. So, we'll see. So, everything's okay pa. I will not be able to take videos inside the unit, but what's happening with my voice? But I'll keep you posted on the ganaps and the routine on a day shift. So I'll see you later. Maybe on my first break I can update you. So see you later. Hi Jollibean! So just a quick update. I am on my first break and it's already 10:30 in the morning. So if you notice, I have changed my uniforms to scrubs because my patient is a COVID positive patient. So ayun. So this is just a quick chika. I'm gonna go back now and I'll keep you posted maybe later. Bye! Hi Jollibee! So I'm back home. So I wasn't really able to film the entire vlog on the day of my shift because when I came home, parang I was super tired. Like my energy was super drained. When I came, natulog na lang ako. So now, I'm gonna be sharing with you the routine that we have in intensive care on a long day shift. So it's still a long shift. It's a 12.5-hour shift. We start at 7 in the morning and ends at 7:30 in the evening. So at 7, once we receive the allocation from sister in charge of who's our patient going to be, we then go to the bed space. It does not necessarily mean na pag intensive care, you only get to have like 1:1 patient. Sometimes it depends. If the patient is a level 3 patient, that means the patient is tubed or they're intubated, or if they're on a filter, if they're having like hemodialysis, they're considered as level 3, so they need 1:1 care. But if the patient is parang wardable na or post-op patients na parang hindi naman medyo complex yung cases, that's considered like level 2 patients. So most of the time you will be assigned to 2 level 2 patients, so 1 nurse to 2 patients. So and then if that's gonna be the case, if you will be assigned to a level 2 patients, that's the time na pero medyo tricky siya. You really have to manage your time because you're handling 2 patients most of the time with 2 different cases, 2 different needs, and then you just really have to be on your feet all the time if you're having like 2 patients. So there. At 7 in the morning, we go to the bed space and then we receive the handover from the night staff. So we'll just have to like parang handover lang or endorsement on why the patient is here, what's her diagnosis, what was the plan, what is going on, so that we can also predict on what's going to happen during our shift. So after receiving the handover, I introduce myself to the patient and then gaining consent as well in what I'm gonna do, and then also setting their expectations. What are the things na parang they will anticipate to happen during the day? We're also gonna be assessing their pain levels, if they're comfortable, and just parang gaining parang maintaining rapport or building rapport with the patient. So ayun, and then I'll do ABCDE assessment. So airway, breathing, circulation, disability, and exposure. So that includes your OBS, their vital signs, and then checking all their lines, yung mga cannulas nila, their contraptions, checking as well their pressure areas, because here in the United Kingdom, parang they are very keen dun sa parang mga pressure ulcers, mga wounds, mga blisters, mga bruises ni patients. So everything should be documented. At the same time, In that time as well, I will be doing safety checks. Safety checks includes if meron ba akong enough oxygen sa bed space, if my oxygen tubing is there, if my bag valve mask is there, my water circuit, all my alarms are within the parameters. So parang kasi in case of emergency, if parang mag-cardiac arrest si patient, all the materials are within the bed space because everything happens so fast, parang every second counts. So parang when that thing happened, you don't really have to run far to get all the equipments. Everything should just be within the bed space para ready ang lahat. So that's included on my assessment with the patient. After that, if the patient is able to eat, most of the time, kitchen staff like serve them breakfast. If the patient as well is able to if they have already been assessed by the physios and if they are already parang safe na to walk, we transfer them to the chair, so from the bed to the chair. So that they can have their breakfast, and then while it's done, while they're eating, we are changing the sheets, all the bed sheets, so the pillowcases, the blankets, we change all of that. And then once the patient finishes eating na, we then offer them for a wash. However, in the intensive care, it's not really like parang shower na shower talaga because we don't have toilet. We just give them parang wet wipes and a soap so that they can also have their they can also gain independence in doing their hygiene needs, parang self-care needs na din. They can brush their teeth and all. So yun na, if the patient is able to wash themselves, do things by themselves, then that's all good. So that's less parang workload for you. So if you have 2 patients, if your other patient is doing their bits of washing, then you can go to your next patient, do your obs, do your assessment, do your safety checks, and then offer them breakfast, and then do their wash. So parang everything is covered during that span of time. And then after that, usually the surgeons, if they are surgical patients, surgeons come, they check the patient, they check the wound, if they have drains, they check the output, the fluids and all. And then they also write their plan of the day. And then after that, ICU doctors come around to check the patient, check their pain levels, do their own assessment as well, and they will also write down what's the plan for the day. In our end, whatever is the plan, we just carry it out. Although if there are parang medyo you're not comfortable in doing the plan, you can always speak directly with your sister in charge or speak with the doctors about it to discuss. That's the thing that I like most here kasi it's different sa Pilipinas, because if parang whatever is the plan ni doctor, okay, carry lang ng carry si nurse. Parang we don't have the right to voice out na I'm not comfortable to carry this plan. But here they are very open about it, to know your thoughts, to know what you think. You are really like parang advocate of the patient, protecting their safety, protecting their rights as well. So parang if you're not happy to do a certain task, or if you're not confident, you can go easily speak to your sister in charge, or and then the sister in charge could speak with the doctors about it. So there, and then in the afternoon, maybe after all parang self-care needs ni patient, in the afternoon we serve them lunch, and then physio come around. That's the time na they will encourage the patient to mobilize, to walk. So sometimes or in most cases, parang there are a lot of parang contraptions si patients. So there are IV medications, there are epidural or pain control analgesia attached. So physios also need help with the patient because sometimes patients are parang wobbly pa, especially after surgery, like the anesthesia is starting to wear off. So parang they're very prone with hypotension that can sometimes cause them parang to collapse or feel dizzy. So sometimes they will need 2 people to assist the patient. So for us, we support the patient, we support the physio, and let the patient walk. So parang you're just really gonna have to walk. Parang in my experience, parang the peaceful time during the entire 12-hour shift is like around 3 to 4 in the afternoon, where I can complete my notes as well, because it's not just only the surgeons and the ICU doctors who come in. Sometimes the dietitians as well comes to check in the patient, especially if the patient are not meeting their nutritional targets for their weight and for their age. So ayun, and then if the patient as well has a stoma, Stoma nurses as well check the patient, and then they are the ones to educate the patient on how to change, what to expect, and they're also gonna be like parang educating the patient of the supplies. Who else? Psychologist. We do have like a tool na ginagamit namin sa ICU to see if how the patient is parang coping with their situation, with their admission, and if their score is high, so that is referred to the site psychologist. So they visit the patient just to assess if how they're doing, how they are coping. So that's also one. Sometimes like if the patient came in because of the surgery, and during his stay in the intensive care he developed parang complications sa heart maybe or something, they're gonna be referred, for example sa heart, they're gonna be referred to the cardiologists. So cardiologists come to see the patient and check on them and assess them. So what I notice is really it's a holistic way of caring and looking after the patient. So there are a lot of people involved. So me as a nurse, what I usually do is make sure that everything is documented, that I know all throughout the conversation at the same time, so that I will be able to properly hand it over. Around 6 in the evening, we complete all the checks, and then we drain all the drains that we have sa patient. It may be urine, or it may be the stoma bag, or it may be the parang chest drains that they have, and make sure that everything is documented. The most important thing really is that however busy you are during the entire day, you just really have to document everything, because if that certain thing is not documented, then obviously it hasn't been done. So documentation is really key. So at around 7 in the evening, night staff nurses come around at that time. Then we do handover on what's the plan for the day, what happened, any highlights or any progress. So yun. So on a regular cases, that's that. The only difference when handling COVID patient is that you're really gonna be on PPE, which is quite parang tiring and exhausting then, especially the weather now. It's summer, so it's very hot. With regards to giving the care, nothing's really different with the regular ones. Just all that PPEs. The quality of care will still be the same with other patients. Parang pros and cons lang on a day shift. Pros is there's a lot of learnings, because there's a lot of people, a lot of interventions that you have to do, a lot of thinking as well. Too many things to learn from people who's involved in the care. Cons is, what's the cons? Cons is I have to wake up very early, so I have to force myself to wake up at 5 in the morning really to prepare. And another is on a Sunday, when I am on a long day. During Sundays, there's no bus that time at 5, so I'm gonna ride Uber, which is quite more expensive than riding the bus. So that's another con. What else? Yeah, I think so. The only thing that I can think of. Either shifts, they are both parang tiring, but at the same time fulfilling if you have been able to do the job properly. And it's just parang heartwarming when you go home and say, goodbye to your patient. The patient would like appreciate and thank you for the care that they have been receiving from you. So parang good job ka na dun. So yeah, basically that's what we do. I hope you were able to parang grasp and imagine the whole situation, all the parang chaos on a day shift. But it's really tiring siya, but it's a fulfilling kind of job. So there you go. That's it for this vlog, Jollibeans. I hope you enjoyed and learned something too. I'll see you on my next vlog. Bye!